Okay. Hello, everybody. Thank you for waiting. We are ready to get going now.
Welcome to today's live stream. This is Dr. Jones, and this is
I'm Eliza.
my able assistant, who also happens to be a relation. She's my daughter, so I can tell her what to do.
Yeah.
Eliza, next.
Okay, so today we're going to be talking about allergies. I'll start with just saying some questions, and Dr. Jones will be using the slides here today. So,
Right.
first question. Oh, and
Sorry, I
Cassian
just
will
wanted
do
to
this one
here's
for
our
us.
semi-assistant, our cat Cassian,
Or
who
he's our
happens to
special
be
guest.
has a mild allergy, so it's a very pertinent for today's video. So thanks for being here, all of you. How many of you are here? Which is great. And all of this, so this whole live stream is being recorded. So you're going to see me speaking, occasional the cat, maybe the dog, along with all these slides. So you'll get a copy of all of it that you can refer back to. Okay, far away.
Okay, so
Interviewer.
question number one is what are the most common causes of allergies in our pets, more than just pollen?
The most common causes of allergies in our pets. Unfortunately, there are many, many, many potential causes, and I think I'll just scroll through to the slide. But before we even jump right into that, I just wanted to mention a couple things. I mean, just in reference, 20 to 25% of all dogs are going to have some type of skin disease. An allergy is huge. I mean, that would be the most common reason I ever saw a dog at the veterinary practice for an illness. It was itching and scratching, recurrent ear infections, etc. And it just seems that the incidence of allergy has risen. So now it's upwards of 20 to 25% of all dogs, which is huge. Then even if we go on to our cats, like Cassie and the cat here, it seems to be rising in our cat population. He is a seemingly healthy mixed breed cat, and he is itching. I'm not exactly sure why. They're saying so upwards of 15% of all cats can have one type of skin disease in their lifetime. So what is an allergy like? Trying to figure out what's the underlying cause. It's just defined as something where the immune system doesn't react inappropriately. For majority of our animals, it's environmental. And what's happening is that there is some type of protein, maybe it's pollen, it penetrates into the surface of your dog or cat skin. And then the immune system sees that, recognizes it as abnormal, and that's triggering this whole itch scratch cycle. And you're going to see me pop my glasses off and on. Might be better if I leave them on because I'm trying to read the PowerPoint slide and talk to you guys at the same time. So some of the underlying causes, obviously genetics, like certain breeds is much more common. Something else is though things that have triggered the immune system inappropriately, like vaccines. We're suspecting some of those environmental toxins, things that we might spray in our lawns and in our yards and our houses might also abnormally affect the immune system, cause it to react inappropriately. The makeup of gut in their bacteria, the makeup of the bacteria in their intestinal tract, the microbiome, that can play a role. Obviously, your dog or cat that can be allergic to things, right? I.e., food, as I suspect our cat might be. There can even be medications that are altering the immune system. And then if you look at the list of allergens, I'm not going to go through all of them, but really it's potentially large. So those are the outdoor things which are happening now. It's spring-ish, probably more spring where Eliza is, and for some of you, probably much more springish, maybe even it's summer. Where you've got the grass growing, you've got flowers starting to show up, they're releasing pollen. Inside your house, for instance, one of the big allergens, anytime we do allergy testing, these little microscopic mites, of which there are millions in most people's houses, probably more in university residences, they're called like house dust mites, right? And they're a really common allergen for dogs. And then you look at other things. Obviously, you can be allergic to fleas, and then there's even all the different foods with the animal protein being high up on the list. And then with cats, much the same thing. Obviously, it's less common in our cats, but whatever your dog is allergic to, your cat potentially could be allergic to. It just seems that within cats, more common is the food. The most common food allergen would be fish. Next would be dairy. Next, potentially, would be a protein such as beef or pork.
Okay, next question.
Any thoughts on that?
For me? No.
Yes.
But for everyone else who's watching, if you do have any questions, just write them in the chat and I'll try and keep track of them, because after we'll have about 10 minutes of a Q&A where I'll ask Dr. Jones questions and he'll answer those. So when you do have them, just put them there. Next question on your slide here, that is, does your pet have an allergy? Signs and symptoms.
It is, but just before, the one thing I want to back into and backing up onto that, as far as like, why are we seeing more animals with more allergies? I mean, I get asked that even on YouTube and YouTube comments via the support questions that come in, being all the social media channels. We don't know for sure why. Obviously, there is a combination of genetics. Some people are wondering now about how our animals are getting exposed to less outside things, i.e., the earth is potentially cleaner than it once was. And when they're young in development, we want them to get exposed to certain bugs, etc., so they have an immune system that develops normally. And in some cases, if that doesn't happen, then you can see like an increased chance of an allergy developing. But it's a combination of genetics, probably all different things we're feeding our animals, along with these different environmental toxins. You talk about, in many cases, they've been exposed to more and more vaccines. It's upset the balance of the immune system. Now it's not responding how it should be. Hence an allergy. What are some of the signs and symptoms? Which is the first question you asked me. So for the most part, if we're looking at a seasonal allergy, right? And most of the time it is seasonal. I guess we're spring, summer, fall, right? And that's where you see, and what's the biggest sign? A clinical sign is itching, right? Which we all see. Maybe they're itching their face, their feet, they're licking their paws, excessive paw licking, recurring ear infections, right? And you can scratch all areas of the body, see it go to hair loss. Then you can see secondary skin infections as a result of that. You might see these reddish pustules throughout the body. But obviously, the single biggest thing is itching. I mean, much the same thing if you had an allergy and your skin is scratching, you've got eczema, translate that to your dog. Other signs are less typical. Sometimes with dogs, the first sign might be recurrent anal gland problem where they're maybe dragging their bum and people think it's just an anal glands. That can be a sign of an allergy, right? And in some cases, it starts as maybe a food-related thing. You might see vomiting, diarrhea. But for most of the guys, it's itching, degrees of hair loss, secondary skin infections, right? And then my list, as you can see, is pretty extensive here. Excessive shedding, you might see hives and acute allergic reaction, frequent or recurring skin infections, pawing at the face of the ears. Even you get changes in skin color over time, or goes from sort of a nice lightish pinkish color to actually almost a thick black. And the skin actually gets thick with chronic ongoing allergies that don't get treated. Unfortunately, which I saw all too often in veterinary practice. Cats, not quite the same. You're still going to see itching, as in our cat here. See, I think you might see under his chin. Can you see under his chin? Maybe not. He's got a little bit of hair loss right now. We won't let us see under the lower part of his left chin, actually. And he is scratching his face, which makes it's more common in cats to do that if they specifically have a food allergy. But I've been playing around with this food, haven't figured it out yet. Not uncommon to see intestinal symptoms, vomiting, diarrhea, sometimes sneezing, runny eyes, maybe discharge from their nose. For our cats, typically we don't see that in our dogs. So okay. Next, this the third question?
Yes, this is the third question, which is just the top natural remedies for atopy.
Right. So we used to call it inhalant allergy, where we thought it's things that you inhale, your dog would inhale and trigger the itch scratch cycle. Now I call it atopic dermatitis. So it's these allergens that are in the air, typically landing on the surface of the skin. There's a breakdown in the skin barrier. They get absorbed, and the immune system recognizes this protein as abnormal, and it just triggers the whole itch scratch cycle. Like it's causing things like mast cells to release histamine, and when they release histamine, oh, you want to itch, which what's happening. And as you can imagine, this little pup here, and you can see the ears all swollen. So I wanted to talk about some of the simple things to start with, both conventional, but could be a home remedy. They don't require prescription, as well as some of the natural holistic products. Right, for one, like antihistamines, Benadryl was the old standby. Like I have it here, right? Benadryl, diphenhydramine, doses of 1 milligram pound, 1 milligram per pound, 2 to 3 times a day. But there's a newer antihistamine, Zyrtec, of which, here it is here. Wasn't too good, my totally prepared. So this is it. It's called Reacting in Canada. The name of the actual drug is cetirizine. So it only needs to be given once every 24 hours, which is really interesting, as opposed to once every 8 to 12 hours. And it has less sedating qualities, a little bit safer than Benadryl. So definitely it's the antihistamine of choice. And it's meant for like short-term use. Zyrtec dose, you got it 5 milligrams per 10 pounds of body weight once daily, right? And these, I believe, are 10 milligram tablets. So for a 10-pound cat, you get half a tablet once a day. Definitely a better option, and it's being used by a fair number of animals. Had some good feedback from people using it. Even when I started in veterinary practice, if it's still the same now, if you're going to use an antihistamine, you need to combine it with a good quality essential fatty acid supplement. Here's one, which is ours. It's the krill oil. You can always use the fish oil. Regardless, you need to have high levels of EPA and DHA. That's the anti-inflammatory fatty acids. And they do such a good job, especially in combination with the antihistamines, to start to interrupt that itch scratch cycle. The antihistamines would be meant for short-term use, but it's the essential fatty acids, like this guy here, which my cat is on, they're meant for long-term use. Right, doses of 500 milligrams, which is one of our capsules, per 10 to 20 pounds of body weight daily. And of all the things, you're going to take one thing out of it, just get your dog on a high enough dose of the EFAs, right? Often they start in too low of a dose, and you need to honestly give it a good, like before you say, is it working or not? Do it for a full 3 months. Like it takes a long time to really judge it, but if you do it long enough at a high enough dose, I think you're going to see some benefit. Natural antihistamines, nettle is a good option. So you can get nettle as a tea. It's just stinging nettle. It's a plant found all over the place. You can just make the tea. And one of the things I said, just make nettle tea, and you make a cup of it and substitute that for your dog's water. Have them drink nettle for 2 weeks and just see, like, is it helping or not? It's also a great source of nutrients, really rich in B vitamins, a reasonable good source of iron. It's got some good minerals in there as well. Quercetin is a flavonoid found in apple peel. We have a quercetin supplement. It's also got some great antihistamine qualities. I'm going to mention it later, just in some of these slides. There is a herbal supplement called licorice root, which I have some. Here it is here. So in part, it comes right the licorice plant. You take the root of it, and it is really sweet. It was sort of one of some of the original sweeteners, and that's why licorice, supposedly, if it's made really with licorice root, tastes kind of sweet. But the big benefit of it is considered the natural corticosteroid, and there's something that's meant for short-term use, which can quickly stop your dog or cat from itching. Right? It's not meant for long-term use. The tincture is very reasonable price. We had remember Jesse, Eliza?
Mm-hmm.
We had a dog named Jesse. He was kind of Portuguese water dog cross. Often he had a bit of some skin allergies, and often at night he'd be in there licking his groin, lick, lick, lick. I'm like, oh, which makes it difficult to sleep if he's sleeping in the same room that you're in. So I give him a dose of licorice root, and in about 30 minutes he responded. So I actually found it worked pretty well. And it's meant for short-term use, maximum of 14 days. There's a bunch of different herbal creams to consider, ones with licorice, ones with chamomile, even burdock, and they all have definite, like, real anti-itch properties. And it's really good if they're also combined with something like beeswax and or coconut oil. And I did have a little cream sample here. There's a homemade cream recipe I'm going to show you guys later in the presentation that you can refer back to. And it's great if you're just dealing with a localized allergy. And the other thing with some of these homemade creams, it's safe for your dog to lick them, or safe for your cat to lick them too, which is really nice. Honey is great for local desensitization. We're already gone. Wow, 15 minutes and I'm just getting warmed up. It's good. And a lot of this you guys can refer back to. That's the good thing. And I think we'll share. Can we share, Eliza, the slides with them? Yeah.
No, but this is recorded, so people
What?
can see it there.
You must make that happen.
And we also can make a couple posts about it, just summarizing some of this information.
Okay, all right. Okay, we'll figure a way how to share it.
It will be out there on Instagram and Facebook. Yes.
Yeah, you should talk to the boss. Okay, so honey, the good thing about honey is that if your dog has an environmental allergy, why he's allergic to a flower that's pollinating. If say for instance it was something like dandelion, well, if those same bees, they use dandelion pollen to make their honey, they're going to have a small amount of that pollen is going to be in that honey. So if you can get local unpasteurized honey, you could give that in a small amount to your dog over a 2 to 3 month period. In some cases, that'll help him get used to that pollen. It's called desensitization, and essentially make him less itchy or responsive to it. And a number of people have said this has actually helped, but it needs to be local unpasteurized honey, and your dog needs to have an allergy where it is to a local pollen that these bees are using to pollinate and make honey with. This is sunflower oil, and the great thing about it, it helps rebuild the skin barrier. Remember how I talked about the allergens get through the surface of the skin, and that's what triggers the whole itch scratch cycle? You can put topical sunflower on. You can put it, say, in the back of your pet's neck. The reason I'm lifting the cat up is I've got this new camera that's supposed to like AI us and move around with us, but it doesn't seem to be working. So what you do is you put it, say, a spot in between the shoulder blades or just behind the back of his neck, 3 or 4 spots along his back. And he'll absorb some of that to spread the fur so it goes next to the skin. And by doing that, he'll absorb some of that into his skin. And that's an easy, inexpensive way to help rebuild the skin barrier. You're going to have to do that for at least a month, whether you can say if it's offering any benefit or not. And the sunflower oil can also be used topically for areas of red inflamed skin. It has some anti-inflammatory properties. Here's a homemade topical skin tincture cream I was talking about. The big thing here, you're using coconut oil as a base, so 2 tablespoons of coconut oil. Then you're using 2 tablespoons of sunflower oil, right? So then that's the ceramide that we're going to help rebuild the skin barrier. You're adding in the licorice root tincture, this guy here, because it's got the anti-inflammatory properties. And the other one I really like is lavender essential oil. I've suggested 10 drops. You might have it here. Can't see it, but this is super inexpensive, right? This is about 10 mils. I mean, this thing is probably 2 years old. It lasts a long time because it's got some antifungal, antibacterial properties. Also has some antihistamine qualities. It'll make your dog feel slightly less itchy. So it's super good, a good combination. Just avoid the lavender oil if you're going to use it for your cat. This is a type of fat or like a type of steroid that's isolated from soy called beta-sitosterol. It's used for people to lower their cholesterol. It's not really a big problem in our animals. And it's also used for people who have enlarged prostates, typically middle-aged to older men. It's not a concern for you yet, Eliza? Nor should it be. But what the interesting thing about it, I'm not actually sure how it got studied, but someone wondered if this type of steroid could be beneficial for allergies. So it was specifically studied for atopy or atopic dermatitis, and they found about a third of dogs responded quite well to it. So it's relatively inexpensive. This is a version I got at the co-op, and what you're doing is, and it's actually also combined in, usually it's in flax oil in a little capsule, and I think I suggested a dose about 1 to 2 milligrams per pound of body weight, once or twice daily. But you need to give it for at least 30 days. But if you've tried everything else, nothing else has worked, it's worth trying beta-sitosterol. Also, they're also called plant sterols if you search for them on the internet. And this is our quercetin supplement, which I mentioned earlier. So quercetin is a beneficial nutrient. It's found in, oops, the cat's about to step on our presentation. It's found in apple peel. It's found in red onion. It's found in kale, for instance, like some of the green leafy vegetables. And one of quercetin's big benefits is acting like a natural antihistamine and helping decrease the level of itching. Right? And there's been we've had a bunch of people say of all the things they've tried, like this guy really made a difference. So this is our quercetin supplement. It doesn't need to be ours, but we've seen some really good results with it. And we're looking at quercetin doses, 50 milligrams for 15 pounds of body weight daily. And the interesting thing is this guy here is now on the quercetin and he's eating it. I just mixed it into his food. So pretty happy to see that. And he's only been on it a few days, so I can't really remark on it yet, but he seems to be a bit less itchier, which is great. Eliza, any other thoughts? I see. So we're going to save questions till the end.
Yes, I've been writing them down. Yeah.
Oh, perfect.
Yeah, we'll do most at the end then. Okay. Next one then is, what is a natural flea and tick shampoo, spray, any effective nutrients to feed?
What do you think of ticks, Eliza?
Well, I certainly don't like them, and I don't think your pet's going to like it very much either.
No. So part of the issue, there are a bunch of different holistic products. It just seems that as things are changing, climate's changing, we're seeing more ticks. They're moving further north than where they previously were. They're able to overwinter longer because things aren't quite as cold, so they don't die. And likewise, fleas. We're just seeing an expanded flea season in some areas. So there seems to be more of them. And especially with ticks, part of the fleas, not so much. They don't spread many secondary diseases. I mean, they do transmit tapeworms. But the ticks have a whole host of other diseases that they can spread, like Lyme disease, like Ehrlichia, Anaplasma. There's a bunch of things your ticks can give you that you really don't want, and you sure don't want to give to your dog. Fortunately, our cats are pretty good. If they get a tick on them, have you noticed, Eliza? If your cat had something on him, he grooms himself. Right. So if he had a tick, he'd pull it off. If your dog had a tick, you might just wonder, why is there some critter biting my ear? So it stays there, whereas the cats are pretty good at self-removing ticks. But part of the issue is you've got some of these pretty potent flea and tick medications, conventional medications, that have a bunch of side effects. Like there's concerns about doing them long term. They get absorbed into the bloodstream. Then, I mean, one of the big concerns is, how are they compromising your pet's immune system? I mean, definitely asking more work from the liver, for instance, right, to metabolize that. And there is serious concern around, are we seeing an increase in incidence of cancer because of some of these insecticides? Possibly. I know I'd be pretty concerned about giving something like, here, I think I have stuff here. So here's one. I mean, it's great, called Bravecto. Kills all fleas, kills all ticks. All I need to do is give this one pill. Here it is here. Just need to give this one pill to Tula, Eliza, once every 12 weeks. That's it. Doesn't that sound great? It's like the magic pill in Bravecto. It's going to kill fleas for the treatment and prevention of flea infestations, tick infestations for 12 weeks. 12 weeks. Wow. But the problem is, it's difficult to kill ticks. So if you got something that's going to kill ticks, prevent them for 12 weeks, alarm bells goes off, right? So some of the thoughts is that some of these flea and tick medications, they work by affecting the nervous system of the tick, the nervous system of the flea. Well, they can cross your pet's blood-brain barrier and then affect their nervous system. So you can see how, and if you look at reported side effects, pretty substantial, the numbers, especially with this newer generation flea and tick medications. So that's why I'm going to be thinking about using the alternatives. So this one called garlic barrier, great for stuff around your house. And it's not just like, does it work? It does work, right? And they said that, yes, you have to spray it more often, but it can really provide a minimal risk option for the short-term control of, one of the tick species, Ioxides, right? As opposed to some toxic insecticide. I want to show you the shampoo recipe, which is kind of an interesting one. Be used for fleas, could also be used for ticks. So number one, you're using as a base, I wrote down black tea. You could also use green tea if you wanted to. The second one you're using is a pretty potent and documented insecticide. It's called neem oil. Here's some neem here. The thing with the neem is, as you can see how thick it is right there, it's got to be warmed up. It's still rather cool in here. I'm in Canada, and where I live in Nelson, where Eliza sometimes lives, it's still pretty cool. So things get cold at night, and it looks like it's almost more like a coconut oil base. But it's got a ton of studies behind it. It's probably the most, of all the different herbal insect repellents, the one that's got the most studies behind it, shown to be more beneficial for fleas, more beneficial, almost as beneficial for ticks. And when it's used at the right concentrations, it's considered safe. So that's why we're only putting in 2 mils, which is 2 dropperfuls of neem. So that makes, and you add it with 1 cup, that makes it a 1% dilution. 2 and 250 mils. It's a 1% dilution, making it very safe. Then you're adding in another essential oil called cedarwood oil. It's got some really good documented repellent properties, and when it's appropriate concentration, also considered safe for our pets. And the last one is called castile soap. Here it is here. It's this, like, here's what I just got it from the co-op, right? It's all natural soap. It's made from a bunch of different natural oils, so it doesn't froth up the same, but it doesn't have all the crazy chemicals that normal soap does, right? So it just makes a really good natural flea shampoo, right? So you're going to lather your pet up, leave it on for a full 10 minutes before you're going to rinse that off. And then I want to show you this recipe, flea and tick spray recipe, where you included the neem we just talked about. Here's the neem here. And then you also included, so turmeric, which is probably the spice you guys you might be using to make a curry tonight. You, Eliza? Do you have any
No.
turmeric? No, you don't. So this is the essential turmeric essential oil, which also came from the co-op. I seem to frequent that store a lot, buying these things. But the really interesting thing is I was reading a study, not even a year ago, where they were reviewing, because humans aren't really fond of ticks. You said you're not fond of ticks, Eliza's. Nobody is, I think. And likewise, we prefer to use more natural products. So they looked at all the different oils they studied, and it actually came out on top as being probably the best repellent one they compared. And it was effective against most species of ticks, right? Because there's a number of different subspecies of ticks. So it's like, okay, this turmeric essential oil. So this incorporates the neem, which we know has got proven repellent, the turmeric essential oil proven repellent. So to get a 1 cc of turmeric oil, it's about 20 drops. In most essential oils, is about 20 drops of that oil equates to about 1 cc or 1 ml. In the neem, it equates to, like, there's a line on here, but this 1 dropper full to the about 3/4 full, that equates to 1 cc, and you'll see it marked on there. Coconut oil, you're putting in 2 tablespoons or 30 mils, and then your base, I've suggested with this, really it's a fluid base. I'm using witch hazel with aloe. So witch hazel is a proven astringent. Like, maybe people use it for acne. I don't know if you have ever used witch hazel, Eliza.
No.
No, yeah. Okay. So but it makes a good skin base, meaning it'll draw out any excess moisture. Right? Along with, secondarily, it's got aloe in it, so it's a nice soothing herb on there. It's a good anti-inflammatory. So that makes a really great flea and tick spray base. For a dog, you just comfortably spray them twice a week. And then after you spray them, you lightly mist them. I want you to grab one of these, grab this like a little flea comb, right? And then just, you're just going to, Cassie's also going to substitute for our dog. And just use a flea comb to, just spread it through, right? So you get to spray. I won't spray you, Cassie, but it's fine to be combed. There you go, kitty. Just making sure I got a cat with no fleas. Hooray. Okay. Okay, kitty. Thank you.
And do either of those have like a shelf life?
That's a great question. In the essential oils are stable for a long time, minimum 2 years, but there is no date on here at all. Because when they're concentrated, they're just in their concentrated form, nothing is really able to grow. Yeah, either of them don't have any dated shelf life on here. The other, yeah, I mean, just think about honey, for instance. Have you ever seen bacteria growing honey? No, you don't. You can leave it in your shelf for 10 years, and 10 years later, there's no bacteria because of its antibacterial properties.
Okay.
Uh, then this last one is just an oral thing. Brewer's yeast garlic mix. I said for dogs and cats, very difficult to give it to a cat. But the big thing with of all the different oral things that have ever been studied naturally, like the few things that most people generally agree on that could repel fleas is this brewer's yeast and garlic. Only works about a third of the time, but it's a whole lot better than, in my opinion, using something like this ongoing, right? So you're at what is it in brewer's yeast? We don't know for sure. Maybe it's the flavor of the brewer's yeast. There's high in B vitamins. I wonder if that has some effect on them. It's high in a nutrient called chromium. Maybe that has an effect on the fleas. Seems to repel them, and it's pretty safe. And it's a good source of B vitamins. So you're having a half a cup of brewer's yeast, and you're mixing in a teeny amount of garlic powder, half a teaspoon, which is about 1,000 milligrams. So mix it in a jar, shake that up super duper well, right? So you really mix, make sure the garlic's evenly spread. And they're saying so each teaspoon in the mixture is going to contain about 40 milligrams of garlic for a 10-pound dog. Safe amount would be about a teaspoon per day. For a cat, it's about a quarter of a teaspoon per day. And we've got 2 ingredients that would potentially help repel fleas and potentially ticks. And I did try brewer's yeast on our cat here, Cassian, and he liked it.
Okay, next question. I actually don't think I have this question on my list, so.
Oh, you don't?
Well, my next one was, is it yeast?
What did I talk about? Oh, it's possible I forgot to give her.
Okay, well, that's okay. What's the importance of avoiding steroids and understanding the risks of new veterinary drugs?
Right. So, I mean, this in part goes in part of the vein we talk about the flea and tick medications. So, there are a bunch of new drugs. They were just coming out as I was leaving practice, especially there was Atopica, which is a immunosuppressive drug, Apoquil, Cytopoint. They're all immunosuppressive type drugs that are working on blocking some area of the inflammatory cascade. They might interrupt some enzyme, and by doing that, you don't get this whole series of events that results in itching and scratching. Which, like, does that sound great? You know, give an injection every so often, and your dog doesn't itch, or you give these pretty safe tablets. Like Apoquil as well, it's probably the more popular one of all 3 of these, and your itching dog no longer itches, right? The drug we used to use most commonly, still pretty commonly used, is a steroid called prednisone. But here, I mean, it can cause increased drinking, increased urination, a whole bunch of other things, right? May gain weight, they might be excessive panting, it suppresses their immune system. They may have these distended swaying bellies, especially long term. And there's other things may turn them into diabetics. They might have Cushing's disease, right? So that's just super short term, minimal side effects, but so many animals were maintained on it long term, and that's why you're seeing secondary complications. So now after prednisone, now you're seeing some of these other drugs becoming more popular, like Atopica or Apoquil or Cytopoint. Like, don't get me wrong, prednisone is still widely used for lots of different things. It's not just used for allergies and say some of these autoimmune diseases, but also, and in some cases, still many animals with allergies, especially short term, they're given prednisone. But these new ones, as I said, they're suppressing parts of the immune response and decreasing the inflammatory mediators. But the problem here is that was what they're upsetting a normal body system. So it's great they stop the itching, right? But then they also are what be interrupting would maybe be a normal immune response if your dog had like an infection that needed to be stopped, for instance, or he's got some nasty virus and maybe he's been exposed to the bird flu and you want an appropriate immune response, maybe then he won't respond appropriately. So that's why you can see things like you get obviously GI signs. You can see immunosuppression. You can see more common repeated skin infections, ear infections, maybe eye infections. It can affect the liver, increase liver enzymes, maybe behavioral changes, right? So all those different things. So I think the point I'm trying to make here is yes, if you've got a dog who's got this extreme allergy and nothing else works, like say you do a proper food trial and you rule it's not a food allergy. You've treated your dog for fleas and you know it's not something more serious like a mange mite. And you've done all these holistic remedies, maybe some basic conventional ones, like and nothing else has worked, well then obviously it's better if your dog is comfortable versus not being comfortable. But what I find is the majority of pet parents haven't done that first. Like they've tried some things, they did it for a couple of weeks, they didn't, they did it for a week. They gave their dog the care system for a week, it didn't work. They're like, forget it. This stuff, it works quicker, right? But just really think about the long-term side effects and know that if we're on that pretty strong medication long-term, it makes you think, there's potential for big side effects. Much the same thing is applicable to our animals. So just be really thoughtful of that. So this one, did I give you this question,
Yes.
interviewer?
Yes, we have these questions. So this is like about the last kind of couple questions, which is it yeast? Is it Frito Feet? What are some solutions and what do people need to know about them?
Okay, so this is one where say you've got a dog, like say your dog has allergies like Tula and I had her on, I had her on, some nettle as a natural antihistamine, or maybe the quercetin. I had her on the essential fatty acids. She seemed pretty good, and all of a sudden, she really starts itching again and again. Like, what's going on? Like, what's the trigger? So the one thing I want to talk about is a secondary skin infection called yeast or malassezia, right? So why would you suspect if your dog had yeast, right? Well, first of all, there's normal to have small numbers. Like Eliza, you probably have yeast on your skin right now. You don't know about it.
Oh, that's
You
new.
do. You can't. It's just very normal. Just like you have millions of bacteria all over the place. You even have little mites in your eyebrows.
I did know
Isn't
that.
Yeah. So they're normal inhabitants of the skin, but they can overgrow when the immune system is suppressed. Maybe you've given a drug like a steroid or something, allows that to grow over. So typically we've got an animal who's got a chronic allergy, and all of a sudden they really start to increase itching and scratching much more. They become less responsive to the conventional treatment, or you give them a bath, and right away they have that really strong odor. Then you're going to suspect yeast, right? And so what you might see, I don't think I have a slide there. You're going to see this skin is thickened. It's often a little bit crusty. It might even be a bit yellowish. And often there's a bit of an unusual smell when you go, especially going to their armpits, for instance. You can't know for sure, but that would be one big, like, something big would pop up in my mind as a veterinarian, like, okay, I wonder if this is yeast. So in a clinic, you can test for that. You can you actually put on packing tape on your dog. You take a sample of skin off it, you dip it in some stain, and you can see the yeast in a microscope. You guys can't do that, but that would be, what you would really wonder about in your own animal if that was the case. So if that was the case, I think it's probably yeast. Like, well, how would you treat that? So when I talk about topical treatment, this is one which involves, I think the similar thing we just talked about earlier, that skin cream is also a good antifungal, right? Where you could use the coconut oil, right? The other thing I wanted to do is give you something that if it's going to be put in the paws, it's still safe for your dog or your cat to lick, or like your dog especially to lick. It's really a cat problem. We're using the coconut oil, the 2 tablespoons, using the sunflower oil. You're using the licorice root, and you're using the lavender oil. Because most of the essential oils are also really good antifungals. That's as a cream. As a shampoo, I have it right here. Here it is. Like this is selenium selenide. There's a brand, Selsun Blue. So it's a sulfur-based shampoo. People use it for dandruff. You probably haven't used this before, Eliza.
Nope.
No. It could also work for dogs that had yeast. And There's a real other inexpensive option. You just lather them up. You gotta leave it on for full 10 minutes, rinse it off, do that minimum twice, if not 3 times a week. Do it for 2 weeks. And a lot of these super itchy dogs just responded to the Selsun Blue, or it's like this is the generic form, right? It's just you're looking for anti-dandruff shampoo, and the name of it is selenium sulfide. And this is a better homemade pet anti-yeast shampoo. So actually, Eliza, that is Pearl.
What's that
So
Pearl?
Pearl, yeah, that Pearl was our neighbor's dog. Used to be our first dog, Lewis's buddy, who she had pretty yeasty, smelly skin, right? And her owner Abby was saying, like, I give her a bath, like a day later she stinks. Like it doesn't even last the full day. So I'm like, I wonder if she has yeast. So a couple of things here that I've got listed in the slide are really good antifungals, great for yeast. So the apple cider vinegar is a really good antifungal. Right? So you're using 2 tablespoons of that. The lavender essential oil, it's also a really good antifungal. So you're using 20 drops of lavender. The Castile soap, that's what's going to help lather it up. It help remove out of the excess crust and debris because you need to get that off so that other things can penetrate, get into the skin, and kill the yeast. Then lastly, we're using green tea because number one, it's anti-inflammatory, and number two, it also has some antibacterial properties as well as even some antifungal or anti-yeast properties. So that makes a really good shampoo, and it works really well on pearl. I just made this little mixture. When you add in the vinegar with the Castile soap, it turns all like a weird white color. It doesn't froth up like shampoo does, but you got to leave it on. Like I set my watch and I watched. Like 10 minutes is a long time when a dog is in the bathtub and they want out, but you just got to go for a full 10 minutes before you rinse it off. And it worked well. And I'm also saying you could use that as a soap for the feet if the feet smell. Do I have a section here on? Okay. So there's a thing called Frito Feet where people say their dog's feet smell like corn chips. And what that is, typically, that's just yeast that can get in between their pads. And that's where you get that smell. So the same shampoo you can use as a soap and soak your dog or your dog's feet in that if they've got, say, yeast infection. You can use top, as we're out here, there's Canesten, like it is here. This is just those antifungals that people use. It's fine to use that topically if your dog, if they've got yeast, especially in their paws, for instance, or in their groins or their armpits. We also use this a lot because one of the most common causes of dog ear infections, it is yeast in their ears. So this alone is really good for lots of the dog's ear infections. And in fact, when I was in practice, I had a client who was a nurse who, we swab her dog's ears, a golden retriever, recurring ear infections. I said, it's yeast again. And she goes, I'm just going to go pick up some clotrimazole, which is that's what's the name of the drug of Canesten, and just use that. I'm like, I don't know if that's going to work. Because the vet one is a combination of treatment. I mean, a teeny little vet one, and what do you have? Like about 14 days of treatment, costs you $30 to $45. She could get this giant tube of clotrimazole that would last her half a year. And that worked. So that another simple option for yeast. Oh, come on, thing. I
I
think
think that's it.
we're at the end of the presentation. That's so hard to believe. Anyway, wow. Okay, and that's another option for yeast. And the last thing I want to say with the Frito Feet, I do have on one of the videos on YouTube, I made a combination essential oil dip / spray that you could use. But the big thing, like if you're going to pick 2 really important things for yeast, is the apple cider vinegar is huge. It's like been beyond well studied, along with incorporating that with some of that lavender oil and then adding in the green tea as the base. Great option, right? In there to treat any animal that's especially an animal got a chronic allergic dog, and all of a sudden he's starting to have this funny smell. Quite likely it's yeast. That's another good option to try to treat them. So thanks you guys for going through with our little chaotic presentation. We're just trying to learn how to do. We're trying to do monthly live streams. Just trying to find a better way to do it. I think this camera is better set up for you to see and hear me. How's the? It's too bad we can't get any feedback. Let's see, I don't know.
Well, no one's said they can't hear anything. You're not showing anything, so I think people have been able to see things well.
Okay,
Um,
that's good.
yep. Are you done with the presentation now?
Yes, so those are all the slides. So I'd love to get in if there's some, you guys have some specific questions. You want some
Yes.
feedback?
I have quite a few questions here that I've written down now. So people can still keep putting them in the chat if you still have some. Just the first thing I wanted to say
Oh,
is
there they are. I see now. I was in the
there
wrong. I just figured out how to see them all. Wow.
there is going to be a replay. This is being recorded and it's going to be put on YouTube, so you can rewatch it again, or if you missed part of it, you'll be able to go see the whole thing. So it'll be published after this. For now,
Are you sure?
yes. For now, some questions that I've been writing down from the beginning is some at the beginning, someone was saying they have a Siberian Husky with chronic itching, sneezing, chewing. They have clean ears. They've tried quercetin for a week. Now cetrizine for several months.
That's this. That's the Searzine. That's the
Yeah.
Zyrtec. That's the
Okay. Yeah.
histamine.
And they are also predominantly on a raw diet with little non-grain kibble, but nothing's really seemed to help that. So, what would you recommend?
So they would be get on some higher doses of the essential fatty acids. That so at least like 500 milligrams for a husky. I probably do 1,500 to 2,000 milligrams a day. Probably 1,000 milligrams twice a day. Start in a really high dose of the essential fatty acids to start. Get back on the quercetin, but do that in combination first with those two to start. I do that minimum for a good 30 days. The other thing to consider adding in is there that one slide that I talked about, that beta sitosterol, which is comes under the product, the plant sterols, that may be beneficial in your instance. Some dogs seem to respond better than others. So another good one to consider, but still is probably an environmental allergy. It's just, yeah, it can be challenging.
Okay. One that I say that just came through is what to put on skin around the eyes that's red and itchy.
Around the eyes. Of all the things safe, I wonder what here. Can you guys still see this stuff? Where you can see me, you can see it. I actually like castor oil. Something, it's got some good anti-inflammatory properties, and if anything of that gets into your dog's eye, it's not going to hurt. Because it's nice to put on something topically that's going to give them some relief and won't get in their eyes. The other thing you can do, which I didn't mention, you guys, don't mind me, all my stuff. I thought I had it here. Oh, here it is. Here, sorry. Like here's this is just a goal. So this is just a 1% hydrocortisone cream. So no, we didn't talk about that in any of the slides. And obviously, a bulk for our presentation is what's holistic. But for a short-term thing, this is okay. And any of the conventional treatments, if you give it topically, it is a gazillion times safer, right? So if you can be careful using this, you're really making sure you're staying away from your dog's eyes. This is also another option. The one thing I also want to add in though is your dog itchy? Like that one question I have. Because if they're not itchy and there's just hair loss around the eyes, there is that mite that I mentioned that Eliza probably has called Demodex, which we all have. It's in our
I think it's
eyebrows.
all of us. The comment did say that they're red and itchy.
Or if it's itchy, then it's more likely allergies. You're right. So that's another option, right? You could use something like that short term.
Okay. Another question from earlier. I'm not entirely sure if you actually did touch on it when you were talking about it before, but they were just asking if Apiquil was a waste of money.
No, it's not a waste of money. I mean, it of all the different meds that is out there in conventional vet medicine that is effective, it's pretty darn effective for sure.
Okay.
The issue is that it's it's interrupting part of the inflammatory cascade, which is part of a normal immune response. And so they can potentially lead to all these secondary side effects. i.e. immunosuppression and recurring secondary infections, etc., etc. So that's the issue. You're trying to balance out the side effects, the risks of side effects versus the long-term rewards. And I think for most dogs, if you can go through some holistic options, you don't know, like some respond really well to the essential fatty acids and say the nettle. Some don't respond at all to that, zero, right? Some respond to quercetin, some don't. Like, so that's why I'll often give a number of the different remedies. You start out with 1 to 2, try them for 14 to 30 days, and see which one works for your dog.
Okay, well, further on that then, can garlic be used as a natural alternative to apical?
Garlic, well, it's not gonna block itching. A garlic it's a great antibacterial and antifungal, but it doesn't have any of the anti-allergy properties as far as that goes.
Okay, someone was asking about the krill capsules. Do they need to be open and squeezed out, or is it safe to administer the entire capsule on a daily basis?
Which one that there was the which capsules that beta
The krill.
staurosterol ones? Oh, the krill.
The
Oh
krill.
yeah, you can just pop them. Yeah,
Okay, just give the whole thing.
yeah, definitely give the whole thing.
Okay, someone else was asking for some of these remedies that you're suggesting that there's multiple different kinds that you could use. If you're wanting to use a few of them, is it only safe to be giving like one in the morning and then one in the afternoon, or can you sort of combine them at the same
Most of
time?
the time, most of these can be combined, right? Like you can combine, safe to combine like the quercetin with the essential fatty acids, for instance. So most of them don't have much in the way of contraindications for meds being given together. Now, the difference would be if you're on something like CBD, and they need to be cautious, or if you're on two different medications that might sort of make it worse if you're on an anti-inflammatory medication at the same time. So that would be slightly different because say the anti-inflammatory drugs are fairly demanding of enzymes in the liver.
Okay.
So some cases you give other medications that can potentially make that anti-inflammatory drug stronger. So as long as your dog's not an anti-inflammatory drug, these medications, yes, can be given together at the same time.
Okay.
Supplements, not medications.
Someone else was asking, their dog has been shaking their ear moderately, not pawing, not scratching. The ear is not infected and it looks like it's quite clean. Do you have any suggestions on what they can do?
So I mean that sounds where there's just ear irritation, like we'd see from an environmental allergy, right? So it's probably further down the ear canal because the ears there's the horizontal ear canal, it goes like this, the vertical ear canal goes like that, and we sort of peek in and it goes way down into the ear, which we can't see. So there's swelling somewhere in that part of the ear canals. The similar things you're going to use to take away inflammation in the skin, then you could try for the ear. So I don't know if you tried like some decent dose of the essential fatty acids. Short term, I would wonder is if you try an antihistamine and see, like, does that fix it? Because if the antihistamine works, then you're like, okay, it's probably an allergy.
Okay. Someone else was asking, in your experience, what helps with itchy labs?
Itchy labs. Well, as many of all the breeds, right? It's just the Labrador Retrievers seem to have a higher incidence of environmental allergy. The couple things I'd want to make sure is do a proper food trial, because as you know, because Labrador Retrievers really like food. Pippi was on a bunch of the YouTube videos. Pippi would do anything for food. You could do anything to her. You could do CPR with her upside down. If you gave her a treat, she's like, go ahead. So that's part of the issue is they're eating so many different things that if there's a maybe food reactions are a bit more common in them. So it's not doing a proper food trial first. Secondarily, I don't know why I seem to see a few more of them in practice have secondary skin mites. So there's one condition called a type of mange called sarcoptic mange. And I don't know why in labs I saw it a few more often. Anyway, so if you can just pick up Revolution. I'm not saying use Revolution all the time. But it was a good one to also rule out mange as an underlying cause of the itching. So do a couple things first to rule any secondary things out. If it's not those, then you're going to just treat like many of the treatments we discussed in the live stream for an underlying environmental allergy.
Okay. Okay, I have a few regarding quercetin. So first is there an age limit for quercetin?
There isn't an age limit. It hasn't been studied in really young puppies or kittens, and or like the general blanket recommendations avoid if a dog is obviously pregnant and or underlying organ dysfunction like liver or kidney disease, which is sort of generally we make for most of the supplements. So no, but there is a young age, but I would think anybody, they need to be more like 12 weeks anyway, for sure, before you consider even using it. If not, more like 6 months.
Okay. Someone else was also asking, can they give CBD and quercetin together?
You could, and it might be better if you slightly stagger them. So you let because the easier way to do that would be to give the quercetin first with the food and put the CBD on the gums. So it gets absorbed through the gums as opposed to being absorbed and having the stomach to work. Just you're not mixing two things up in the intestinal tract at the same time. And it often gets a fair amount gets absorbed through the gums.
Okay. And one more regarding quercetin. Someone was saying that their dog was taking quercetin. It seemed to be helping, but they noticed that they would get some tremors or shaking when they were on it. So would you recommend an alternative?
That's interesting. Of course, I haven't heard of that, but obviously if there was a strange side effect from that, I wouldn't want to be giving it to them. An alternative would be, there's an alternative flavonoid. If you're going to try something else, maybe that plant sterol, that beta sitosterol that we talked about as one option. Another, natural antihistamine. I know I also mentioned the nettle as another option. So that's another thing to consider if you're not going to use the quercetin.
Okay. Another question. We'll do maybe a couple more. It's almost been an hour, but someone was asking, can nasal congestion be a sign of allergies?
What is it? Yes. It's unfortunately in our dogs, it's very uncommon. Most of the time, if a dog has an allergy, you see it's a skin disorder. So you're going to see the itching, the scratching, recurrent ear infections. You're going to see the paw licking, blackening, thickening in the skin. That's much more common in dogs. In people, it is more respiratory, right? And in cats, it can be more respiratory. So typically, no, in dogs, it's not an underlying allergy. It can be, but just seldom.
Okay. Another is someone says that they suspect that their cat has pillow foot from an allergy. So what would you recommend to treat this?
They have what, Eliza? Someone
Pillow foot. I don't know do you know what that is?
Let me just read. Can I see? Is it on a comment here?
Oh, I would not be able to find that one again. I think that was from a little while ago.
Okay. Interesting.
Or so this is here. I just starred one of the questions that talks about it. If you go to star, you can see that.
If I go where? To the starred? Oh, starred.
Yeah. Do you see that?
Pillow foot. Oh, someone's asking, is there a topical treatment to help with cracked paws or to help with allergies? So you got the paw. I suspect they're saying in between the paws or maybe cracked and spread. Maybe the paws themselves are swollen. More in our cat, they'll get these. They wonder about some type of fungal infection. It's like first and foremost, I want you to see your veterinarian, get them to see like what is coming out of there, what type of fungus is causing that, because there are other different type of fungi like that could be causing like this swollen pad. or swollen feet first. It's more than just, some of the fungi we think about, like ringworm or something, or malassezia, which we see commonly in our dogs, isn't as much a problem in our cats. And sometimes our cats quite commonly get ringworm, but typically that's just showing up as areas of hair loss, not a lot of itching. So determine the type, and there are other more serious funguses. So I get your cat looked at first. But as a general rule for our cats, if they seldom get some of those serious immunosuppressive diseases. So if they've got that, you also want to make sure your veterinarian is checking for underlying causes that suppress the immune system, like leukemia, FIV. And I think the last thing, as far as going on with treatment, because the most common funguses that cats get is this little one called microsporum, which is the one that causes ringworm. Of all the different antifungal treatments, like easy and expensive ones we've used, this stuff here, like the clotrimazole, the Canesten, and the other one I've used is actually the apple cider vinegar or vinegar. The thing is, if it's red open wounds, that can be really stingy. So you're much better off sticking with something like the cream. So you could try something like the Canesten would be fine.
Okay. 2 more quick questions. First one is just someone was asking that their dog is allergic to apple, so can they still use apple cider vinegar?
Yes, or you can, because you're using it topically. You're not giving it orally.
Okay. And one more here then. Someone's dog has tear stains and they lick their paws and pants. On the parts where they lick, they get the stains. And they're just wondering if you would think that's an allergy or yeast. And that they had done a paw treatment for yeast about 9 months ago, but they still have the same issue.
So what's happening? They have tear staining.
Yes, tear staining. They're licking their paws, and they get like tear stains where they've been licking.
Right. So you're wondering, is that an possible underlying allergy? It is. So the tear staining is either from, so your eyes are always producing tears. That's what keeps the surface of your eye lubricated, keeps them from being infected, and that's what allows you to see, and your dogs and cats to see well. So in some cases, you can have like environmental, like airborne stuff that's triggering increased amount of tears. In other cases, which is much more common, the little tube that goes from the corner of your dog or cat's eyelid into your dog's nose gets plugged up. So then the tears, instead of draining out this tube through the eyelid, they overflow the eyelid and you see them coming out the corner of your dog or cat's eye. So that's why most of the time you're seeing the excessive tearing because of a plugged tear duct. So could that be from an underlying allergy? It could be, right? So then sort of the next part you wonder, because there would be yeast as a cause? Possibly. Many of the dogs, the one thing they do, I didn't mention a few other things. You can try a good quality multi-strain probiotic supplement. In some cases, part of the reason what's happening is that there can be the wrong bacteria that are present in that area. And if you provide like a good quality multi-strain probiotic, I've just seen some of these guys tear a lot less. I think what's happening in that situation is that there's less inflammation, so the tear duct can open up, right? And that allows the tears to then start to flow properly. Like I think in most of the time, most animals that are excessive tearing, anytime I saw them in the clinic, they didn't have an open duct. And the way you check that in veterinary practice is you'll actually take this green dye, you drop it on the surface of the corner of their eye, and you should see that green dye dripping out their nose. And if it doesn't drip out their nose, they have a blocked tear duct. So the other thing we would often do, and sometimes it works well, is just doing a hot compress into the corner of the eye, like right over top the corner of the eye, right there. You do that for 10 minutes twice a day to help potentially open it up. Sometimes the probiotics seem to help. We don't know exactly. It might alter the composition of the tears. There's some newer treatments now, like the company called Angel Eyes. Sometimes what they're doing, they're supposed to provide nutrients that alter the tear composition so it doesn't stain. but you still might have excessive tearing. You're just not seeing the staining.
Okay.
So back to your question, probably for majority of animals that have excessive tearing, often there is an underlying allergy is the basis of it. So you consider a probiotic supplement, consider the topical, like a hot compress, might be helpful in that situation.
Okay. Well, it's been about an hour and just over, so I think we'll end it there for the questions. I've written down some more though, so these ideas will be here and I'll send them to you after. So maybe there'll be some YouTube videos and other TikTok videos coming out on these. So make sure you guys keep an eye out if your question didn't get answered. Otherwise, thank you so much to everybody who came. There's lots of people. We hope you enjoyed the presentation. And like he said, we're going to be doing some more live streams, trying to do it a bit more once a month. And we'll be doing some questions soon. I'll do an Instagram story today, actually, so you guys can put in what you want to see as a live stream, and we'll try and take those considerations into recommendations, and we'll try and make some more live streams on those topics. Do you have anything?
Okay. Yes, sir. The other point I'm going to say is that there's a big creator, Tucker Budson, who I think you guys probably know. There's Tucker and Tucker's son, Todd. I don't think really his son, but anyway, there's 2 golden retrievers with a gazillion people that follow them on YouTube and Instagram, et cetera, et cetera. So we've been trying to arrange a live stream with them, but they've had some family stuff come up. We were hoping to have done it this month. We've since talked to them, and we're now tentatively planning that for the 2nd week of June is the plan. And it's actually going to be on cancer in dogs. And in particular, we're focusing on a bunch of the reasons why it's happening. And then secondarily, some of the more important remedies for you guys to consider.
So keep an eye out for information on that, because that will be coming soon.
Yes. Yep. Okay. So thanks for being here. I hope some of those things have helped you guys. We're kind of working on our format here. But thanks for bearing with us. We'll get better.
Yeah, it'll improve every time.
That's right.
All right.
All right.
Have a good day, everybody.
Yeah.